began my pitch, my crazy pitch, 2 years ago when I set out the framework for what I called the moral determinants of health. That began with my 2019 National Forum speech. My argument then and now is that the moral foundations of the healing professions should push us, logically, toward direct engagement with the social influences on health. I listed 7 suggested targets, areas of engagement. Healthcare, I said, needs to become an active agent of change. Now, reactions to my proposal have been interesting, and they've been mixed. On the one hand, almost every one of the many audiences to whom I've made this case in the 2 years since that forum speech has applauded, and they've welcomed the message, in many cases very, very warmly. Standing ovations are not unusual. Messages of gratitude to me for calling it like it is. And of course, that makes me feel great. But a closer look is much more humbling. The words are generally of praise, but the faces are less certain. I see furrowed brows and narrowed eyes. Often my host, say a hospital CEO or an association executive, will thank me for that provocative speech without being totally clear about what exactly my provocation provoked. In one case, my speech bombed. That was in my annual January class for Harvard medical students and Harvard dental students, where 2 years in a row, 2020 and 2021, my talk on moral determinants of health met with total silence in rooms of medical students and dental students who are usually quite verbal, to say the least. I finally asked the students why. Why did my lecture bomb? And their answer was crisp and it was clear. They said, because we already know most of what you're telling us. We read the newspapers. We have classes on epidemiology and social medicine. We get it. Healthcare does not create health. We understand that. But what are we supposed to do about that? Don't just tell us the problem again. Tell us the solution. So fair enough. That's what I'll do today. What do I recommend? 10 teams. I challenge every single hospital in America and every integrated health system to establish 10 teams, starting now, to reverse the flow of resources, which is now away from health determinants toward health determinants.